Hello, Annette. Annette, you are a researcher, head of important research institution department with people who do epidemiological studies on air pollution and health. And just imagine that somebody knowing this addresses you and says, well, I would like to know what are the health effects in my city, and there is somebody important. Yeah, it's not just a single citizen, but a city wants to know what are the effects of pollution in the city. Is it necessary to make some measures, or actually, if they know what are the pollution levels in relation to the standards, how big are the effects? What would you do? What would you advise them to do?
Well, I think the health effects of air pollution are small. So ideally, you have the possibility to work with existing data and improve this data so that you can address air pollution. So, for example, if you have a good health monitoring system, if you have good hospital counts for various diseases, it's actually ideal to then map the variation in short-term and long-term exposures of the population. If you have ongoing health surveys, that is again an ideal opportunity to link an exposure assessment with these health surveys. If you have neither, then the question is whether to simply apply existing knowledge from cities with similar characteristics or countries with similar characteristics, or to really invest into a study dedicated to air pollution. But my experience is that it's especially fruitful if you can integrate the air pollution research into general assessment of health effects in a population.
Yeah, so you mean, in simple terms, would you say, okay, let's find money for an epidemiological study? I have the personnel, I have specialists who can go there, identify people who are affected by air pollution, and then we know how many people are affected. This is what you would propose?
No, because well, one of the challenges with air pollution is that actually you cannot say this person is affected. This person is sick because of air pollution, and this person is healthy because of no air pollution. I think this is the major obstacle or the major challenge in communicating the health effects of air pollution, because they work on all of us, but they kind of push forward our underlying disease processes a little bit. So this is why I think it would be good to embed a study of air pollution in a general framework of understanding health in the respective city or region.
Mm-hmm. And okay, and the study, so it is complicated. Yeah,
It's complicated.
It's complicated. This is the answer people sometimes don't like, because it's okay. This complicated is number one. Okay, when you can do this study, can I have results of the study before the next election? Next election is in the spring.
Well, the problem is it's not only complicated; it also takes a lot of time.
Ah.
But the good news, well, the good or the bad news is that actually air pollution is not doing so different things in various locations. It's very important, of course, that you would have data from your local regions, but at the same time, it's wrong to believe that people in China or in the United States react differently. They may have underlying different risk factor profiles because they eat differently and their behavior is different. But air pollution pushes the risk through very general mechanisms, and that is actually active everywhere around the world.
So we can learn, actually, being here in Europe, from studies done in China and America, and we are just in the middle. So this is what you say?
Yes, I think we
Oh.
can apply the work done in North America, because a lot of things are similar anyways. And when we and so the actually, if the estimates are different, now we have also estimates from Europe, and if they were different from the Americans ones, then it was more due to different approaches to study them. So, for example, in the escape study, we monitored, or we developed a model to have like every resident in the city characterized, whereas in the United States at the beginning they used single monitoring for a large area, or they used 1 by 1 kilometer grids. So that's kind of a different exposure assessment. So the differences are coming more from these different methods than rather that the underlying effect is
In
different.
different methods, in already conducted studies,
Yes, in
which
already.
have published the results and
Exactly.
so on. So what you propose is that we take those studies, those various studies, and apply in some way in this community, and then the results can be available next spring.
Yes, that is
That is
actually a good
news,
way.
actually.
Yeah, and for example, if you mentioned China before, so when you now look at the studies in China and compare it to all the studies done in Eastern Europe, when there were also very high levels, the results are not so different. So I think one can actually learn from studies conducted in other parts of the world.
Okay, so you may say this pollution level is indeed not good for this community. Can you say something more about those effects? I mean, how many people are sick, or what are the effects? I understand we cannot identify, you cannot identify persons, but can you describe type of health effects which you would expect in this community?
So yes, well, so the health effects we expect in these communities are more or less all, again, globally the same.
Mm-hmm.
So we
I mean,
have,
similar to those as observed in the United States or
Yeah.
in China or
Yeah.
in studies conducted in Europe, yeah?
because the particles
Other
are
places.
deposited in the lung, and so they first affect the lung, but then they don't stay there. They also affect the heart and the reproductive system, and now we also have evidence that it's affect the brain. And it's actually, I think that's again very similar across the globe. And where we have data, there is also a very consistent pattern is emerging. So I think that one can really translate the evidence from around the world.
Okay, so we know which diseases will affect, are connected with exposure in this community. What about magnitude of the problem? Is it just 1 person or 10 persons or 100, or what is the way to assess how serious in terms of in numerical terms,
Yeah.
not in quantitative but qualitative. Not in qualitative but in quantitative terms. Can you do this? I mean, or your group can do this?
Well, I think my group or many other groups in the world can do that, and actually you can also do this in your city, or everybody can do it in their cities, because the WHO has now developed a tool where you can actually plug in the knowledge or the cumulative knowledge, and which can then, if you know the air pollution concentrations, if you know the prevalence of diseases, can calculate how large is the burden from air pollution. And so there have been parallel developments. The WHO has developed a tool, the US EPA has developed a tool, and there's a Global Burden of Disease project. Even though these tools may calculate slightly different numbers, the magnitude of the numbers are in the same range. And so I think this gives a good indication of the burden. And the good thing is that if then there would be measures implemented, then 5 years later, the same tools could show how much the benefit were, or you could even consider certain measures and then use these tools to calculate the differences and how much impact it would bring.
Okay, so there is good news in all this process, that we learn something from previous studies and apply it in a given community and then have results. But do you need something from this community to make those calculations? I understand that you bring knowledge, global knowledge to the table. You take this tool from WHO or other places, US EPA or maybe some kind of calculation method from somewhere else. Good. But do you need from this community, which is addressing you, do you need some data?
Yes, well, there's the exposure data is needed. Of course,
Which means concentration of the pollutant.
Measurements, ideally. I mean, there's of course also a global model, which would estimate the concentrations in the city, but it would be, of course, much better if it would be, if there would be also local data in the city. And then, of course, all the knowledge about how frequent are disease, the population size, and how many people, for example, get chronic obstructive lung disease or get heart disease. That's crucial. That would need to be collected at a local level.
Locally. So we need two streams of data at least. One stream is coming from monitoring or modeling of the air pollution and exposure, and the other stream coming from health monitoring to know what is the incidence or prevalence of the disease. Yeah.
Yeah.
And what is the simplest indicator which I could use for this kind of calculation?
Well, the simplest indicator is the mortality.
And it means number of people dying per year for
air pollution, for the level which is currently there.
Yeah, but so number of people dying of air pollution?
Yeah, dying of air pollution due to cardiovascular disease or chronic obstructive.
But that was my primary question. I mean, what number of people are sick or die because of air pollution? This is what you calculate.
That's what you calculate. Yeah, it's not. That's
so
not.
The input is number of people dying in the population,
yes.
Which is in many places, not most places, available from vital statistics.
Yeah.
Yeah. Okay. So it is possible. I mean, to in most situations to do it, and this community may have its own assessment of health burden due to its air pollution in which the people live in this community. Thank you. That is quite encouraging.
Yeah.
Thank you.
So can I ask you something, Michal?
Yes.
What do you think we researchers, I mean, you have all this overview on the policy side. What do we need to do as researchers? What is the data which is missing?
Well, first I would say we have so much data and so many arguments to fight with pollution that I would say there is enough to take action.
Yeah.
But, there is always a but. There are some questions, especially in countries which, or locations which were able to decrease pollution of particulate matter, for instance, like we have now in Western Europe. In many locations we have much cleaner city from the point of view of particulate matter, which is, you described before, the effects. But we also have those gases, which, due to various situations, are not going down or sometimes even growing. And the question is, okay, how bad it is for our health? And is there a chance to that we actually solve the problem with dealing with one type of pollution and leaving the other type of pollution? Is the effect similar, or maybe there is something else in the air? So there is something which I think is still unresolved question. I mean, keeping in mind that the message about reducing pollution is very solid. I don't think there are any doubts about health effects of PM particulate matter in concentrations above air quality guidelines level. This kind of established knowledge. But there will be additional questions which you have to think. There is a question coming now quite often about those very small particles, so-called ultrafine particles, and those which are orders of magnitude smaller than PM2.5. Are they really hazardous, or the organism somehow able to defend itself? From physics point of view, they should be rather dangerous, but as far as I know, the knowledge about effects they provoke is still uncertain.
Yeah. And I mean, there's also this debate about nitrogen dioxide and whether the effects we see for nitrogen dioxide are actually due to ultrafines or diesel soot. So what is your...
Why you say it is uncertain? Because they come from the same source in urban setting.
What we often
difficult
hear,
to distinguish.
Difficult to distinguish,
Yeah.
and that people argue. We have all these studies on nitrogen dioxide, but people are still wary whether it's really the nitrogen dioxide or it's the ultrafine particles or it's the diesel soot, which actually is just where the nitrogen dioxide is just a surrogate.
Yeah.
So what would you recommend from a policy perspective, how to deal with this situation and the evidence that we know a lot about nitrogen dioxide, and the studies are just increasing and increasing, showing effects, and that you can also distinguish these effects apparently from fine particles, but we have this lack of evidence for ultrafines, and there is this competing hypothesis whether it's the NO2 or it's actually the ultrafines. How do you see this discussion?
No, the problem is about priorities in research, and who is interested is asking question about one, not asking question about the other. So if you want to compare, we should study both at the same time, simultaneously in the same population, and try to weight the evidence on each of them. So I think there is still plenty to do in your laboratory, and your people can do quite a lot of.
Yeah, and I think we probably also need to report everything, right? Not just the part the pollution which we're most interested in at the time, but rather report on all pollutants.
Yes.
Okay.